How's that? Maybe you need to turn this up a little bit. Better?
I can't see.
I think that's better. Okay. Hi, I'm Tom.
I'm no matter.
Okay, so we're going around the country for Maverick Citizen, and we are photographing healthcare workers in every province on the front line, and we're doing interviews with them as well.
We're in the Northern Cape. We are in Durban.
We're in Mpumalanga at the moment.
We're in Cape Town.
Just finished our shoot in Free State. We'll see you in PE. We are traveling in our caravan, which is over there, and we are moving around between different provinces of the whole country, and this caravan is giving us safety that we need so we don't have to stay in accommodation and things like that. Normally wearing masks, I'm talking to you, so I'm not wearing a mask. So this is our homemade studio. We've made it so that we can shoot in any location at any time of day, as long as we've got the back of the studio towards the sun. The whole point of this studio is that it allows us to work anywhere, but also to work safely, because we're working outside. We're shooting with doctors and nurses and cleaners and porters, all who've been working in the hospitals. We need to make sure that they're safe. We need to make sure that we're safe as well.
My name is Andrew Williams and I'm a doctor at Robertson Hospital.
I'm Dlodlo Joyce Buntle. I'm working here at Temba Hospital as a senior clinical manager.
My name is Dr. Kagiso Motse. We are at the Job Shimangane Tabana Hospital in Rustenburg.
My name is Logutula Mapalala. I currently work at Doranginza Regional Hospital in Zweden in the Eastern Cape.
My name is Janelle Beeman and I'm a medical scientist within the Center for Respiratory Diseases and Meningitis at the National Institute for Communicable Diseases.
I'm Zukisa Zingela. I'm head of Department of Psychiatry at Nelson Mandela Academic Hospital and Walter Sisulu University, Department of Psychiatry and Human Behavioral Sciences, and I work in both institutions in Umtata.
Lebitso la ka ke nna Molongwana Sello. Ke bereka mo sepetlele sa Mokopane Regional Hospital.
My name is Sibusiso Njelo. I'm a professional nurse for the city of Johannesburg, working at Snawane Clinic Soweto.
So we're now on day 2 of our trip around South Africa to photograph healthcare workers on the front line in every province. Started in Gauteng on?
Wednesday.
2 days ago, on Wednesday.
The challenges we faced in the beginning, it was mostly about the swabs, the test kits that were not enough. We had a high number of people coming to test, only to find that there's only a limited number of swabs per day, so they had to come back on the following day or maybe the next week. But mostly that was our biggest challenge. Also did not have enough information in the beginning when the whole COVID thing was starting. So getting the system into place of helping people to say how long will the isolation be, how do we go about that, and yeah. But mostly it was just startup hiccup.
On a kind of personal note, the biggest challenge has been balancing family life and work life. But in terms of the actual work challenges, I think the biggest challenge has been keeping our staff happy. Because they've worked extremely long hours, they've given selflessly of themselves, and just keeping them motivated and making sure that they know that what they're doing is making a difference.
We are now in Fraserburg, having gone through Kimberley last night. Yesterday in Kimberley, we met 3 doctors, photographed them.
Yeah.
They were all really great.
Today's been 2 very interesting situations. Firstly, we were going to try and speak to people at our hospital, but we couldn't because nobody wants to speak about the situation. So it seems that there's some really hectic intimidation going on. We try to speak to a doctor, we try to speak to a nurse, and we try to speak to a cleaner as well. And apparently there's a lot of, the cleaners at least are on a shutdown at the moment. I think there's protests or sort of demonstrations with Nehao because they do not have PPE, is what we've heard, but we weren't able to get anyone to speak to us on the record because people are just terrified of losing their jobs.
We're in the Northern Cape here. We've just been at Fraserburg, and now we're just driving to Western Cape.
It's been scary. Let's start with that. It's been scary working on the COVID front lines because it was something completely new. You try to be as safe as possible while seeing patients. But yeah, when I heard the news, I still went into a bit of a panic. Felt very anxious when I heard that I tested positive, because who says you're not going to be one of those patients? You don't know how the virus is going to affect your body. And I think that's the scariest part of it. Going to sleep every night not knowing if you're going to wake up worse the next morning. It took me a month to get back to work, but I think I'm finally close to 100% now. So it's been a long road. It's been filled with ups and downs, because some days you do feel better, some days you feel like it's eating me again.
In the beginning, for everybody, there was a lot of fear. Everyone was scared of what, COVID would bring and what COVID would mean. We've been unlucky that we haven't had as many resources as many places, so we've kind of had to make do with what we've had. And for me, it's been such a heartwarming experience to work with the nurses, team of doctors, people from mortuary, people from admin, all working together to provide some kind of modicum of care for all these patients that were just arriving in droves in their hospital. We felt frustrated, a lot of times because sometimes we couldn't do as much as we wanted to do for patients. But, here, what was really important was people came to work and people showed up for work.
What we had to do was to basically decide where we're going to fit into the management of this pandemic. And because we deal with mental health, in the beginning, the assumption was that we wouldn't really have a major role when the pandemic started. So what we had to do was to then decide, how do we assist in managing the pandemic and making sure that we have a significant role that's going to make a difference. So how we then started changing how we work was to say, in addition to the mental health services that we're providing for the ordinary members of the community, what can we then do to support the frontline healthcare workers who also will start experiencing lots of anxiety and fear as they fight the pandemic. And on that basis, we then started sessions, psychological sessions that we offer to healthcare staff to try and support them in managing all the negative emotions that are arising because of COVID.
We are in Durban to do an interview with an occupational therapist. It is a little bit rainy, so we're a little bit worried. You can see our setup, and we are worried that if it rains, our backdrop's gonna get wet. So it's drizzling right now, and we're hoping that we can get Nikki out in a few minutes before the rain comes pouring down. Hello!
We're back on the road.
It's us again. We are in Polokwane. For this leg of the race, we are going to be interviewing healthcare professionals in Limpopo.
It's been a rough sort of week, being let down by a lot of people. Clearly, the Ministry of Health, is that a thing?
Yeah, well, we say department.
The Department of Health are starting to crack down on who's allowed to speak to journalists and who's not. So we've had a lot of people who've pulled out at the last minute, told us they were going to do the interviews, told us they were going to do the photo shoots, and then just decided not to, which has really put a bit of a downer on it, because we're not trying to expose anything here. We're just trying to find out how people are doing, how the healthcare workers are coping, things about their family and them personally, their anxiety levels and stuff, and that's really what it's all about. But I think there's a real fear from the Department of Health.
I think we must say that we're in Limpopo today, but we were supposed to be in Mpumalanga. So we had made preparations and had conversations with hospitals in Mpumalanga weeks ago. They said yes, they asked us for a little bit of documentation. We provided that. It was all good and great. And then yesterday when I called to confirm, they were like, nah, apparently we can't speak to you without going through the HOD.
So we're wondering what's going on in Mpumalanga. We're not really sure.
Everybody's going through stress, emotional stress. Then you've got the secondary stress as a healthcare professional. At some stage we had an outbreak amongst our staff members. Then we saw them being infected and going back home and going for self-quarantine and getting back healed. And then the anxiety reduced.
We are definitely in a better place than we were in July or August. It's been quite a journey with COVID for the hospital, just all of the damage control we've had to do, just trying to get ready really quickly. But I think in the end we did okay. It's probably better than we actually thought we would do. It's been quite a sometimes difficult, sometimes strenuous, very emotional journey, but I think the team pulled through and we've managed to get through it. As for where we are at the moment, we are hoping we're not getting another second surge, but we've probably got about 2 to 4 weeks before we'll know that. I think public perception of COVID has just, it fluctuated. There was a time when they were extremely scared, so they were cautious. But I think as the days went along, people got tired, we've become complacent. So if social media is anything to go by, we may just be in trouble again in the next couple of weeks.
Everyone at home, I'd say, practice social responsibilities.
And not place others at risk. You might feel that you are young, you are healthy, and if this virus hits you, it won't hit you too hard. But think about the others that you might infect.